You're listening to Health Professional Radio with Wayne Buckler, and today my guest joins me from Sydney, Australia. Dr. Toby Fogg is the Medical Director of Careflight, and Careflight's one of those organisations that everyone knows a little bit about, but Toby's here to tell us maybe some more about it. Toby, welcome to Health Professional Radio.
Hello, Wayne. Thanks very much for having me along today.
It's a pleasure to have you with us. Now, as I said, Careflight's one of those things that, brings to my mind helicopters and exciting news footage. Tell us more about what it is that Careflight really does and what your geographical footprint is.
Careflight was established almost 30 years ago as a charitable organisation designed to provide a rapid response critical care service. And we started off in Sydney, and we still indeed do have a rapid response helicopter here in the Sydney Basin that services about 270 patients a year. We'll fly off to and treat. And we're able to bring highly trained medical specialists and paramedics teams to those critically ill or injured. In situations where seconds really count, the service is so well refined that we can be airborne within 3 or 4 minutes of being tasked, and then on scene in 10, 20 or 30 minutes of the actual injury. So we can really start the high-level critical care treatments very early on after the injury occurs. And that's, as I say, what we've been doing for 20 minutes, but for over 30 years. But we've also expanded our operations. So we also now provide the aviation for the Paediatric and Newborn Emergency Transport Service, or NET, in New South Wales. So we have 2 helicopters there on standby to fly off to wherever they're needed with the NET's clinical staff, and they're available 24 hours a day. And we also supply doctors to the ambulance service of New South Wales, to their Bankstown and Orange bases, to again provide that critical care service to the greater New South Wales population.
I see.
Been very much our core business, but over the last few years we've developed the service in the Northern Territory as well, and now we supply fully integrated service of medical coordination, aviation, engineers, and critical care medical and nursing staff to basically the top half of the Northern Territory. We've got 5 planes and a helicopter based in Darwin and Gove, and we'll treat and transport over 3,000 patients a year, mostly bring them into the Royal Darwin Hospital. And that's the full range of patients, from premature babies to unwell children and adults, as well as trauma victims from motor vehicle accidents, highly remote locations. We also there have a search and rescue role, and our helicopters can be tasked by the government to go searching for distress beacons, for example, off the coast or inland. And also we have a jet in Darwin that will fly patients down to super specialist care in Adelaide or Perth or Sydney, depending on their needs. It's quite a significant contract for the significant amount of work we do for the Northern Territory government.
Yes, it sounds like it.
It's the scale, the distance. It's quite staggering, the size of the project up there. It's very interesting medically to work up there, I have to say.
My guest this morning is Dr. Toby Fogg. Toby's the Medical Director with Careflight, and he's joined us here on Health Professional Radio to tell us about what Careflight does. And we've just been talking about the geographic footprint as well as the Northern Territory. Toby, do you service the mining industry too?
Yes, thank you. We do indeed service the oil, gas and mining industry. We have several contracts with these operators. We're able to provide high-quality critical care doctors and paramedics to support the workers in these very, very remote locations. So one example I could give you is we have a contract with INPEX, who are developing the Ichthys gas fields, which are about 220 kilometres off the shore of Western Australia in the Timor Sea. And we have paramedics on some of the rigs out there, and we have critical care doctors based in Truscott who are able to fly up in a helicopter to patients on the rig, and while they're en route, our paramedics will be providing some initial care. We will then hand the patients to the doctors, who will then fly the patient back to Truscott, and then will be met by one of our jets who will then fly the patient onto definitive care, either Darwin or Perth, depending on the nature of the problem. And our aim is to be able to deliver all that within 6 hours of the time of injury or patient becoming unwell. So it's an incredible feat of logistics and coordination to be able to do that. So we feel we're really, really supporting well the guys who are working in those remote conditions in sometimes quite dangerous environments.
Yes, it sounds like it. And, I'm one of the things that I think has changed in medicine over the last 20 or 30 years has been that if you can get a patient and get them stable, then you have time to get them into critical care.
That's right. But what our aim isn't so much all about rushing the patient to a hospital. We're rushing sometimes definitive care out to that patient.
Yes.
We're essentially taking critical care or emergency medicine care out there to where the patient is located and thereby saving sometimes many hours to start their definitive treatment, or at least to provide a very high level of stabilization should it be an injury that needs to be surgically corrected.
Now, I understand, Toby, that Careflight also has a major commitment to education and training.
We certainly do. It's very much within our culture, and it's something that we've grown and evolved over many years, and now we run many courses really nationwide to help support either the critical care consultants, paramedics, nursing staff. We also have a real major project that is involved in helping train up the rural and regional and remote first responders, whether the RFS, the SES, clinical nurses or volunteers. The course is very much designed to, how shall I say it, to train them how to look after the victims of a motor vehicle accident while the advanced care is on the way. And that may only be for 10 minutes, but in some locations that help could be 2 hours away. And the skills that we teach these responders, it can really make a difference, whether it's a life saved or a disability prevented. They can do so much in the time that they're there with the patients while that help is coming. And to that effect, what we have is essentially a mobile simulation lab and educators that will drive out to these communities. We have a car rollover simulator that we can take with us, so we can actually simulate patients trapped in a car, and we can train the responders how they can help patients while they're still trapped. We're certainly not going to teach them how to do the extrication, but we can teach them an awful lot of things that they can do while the patient is being extricated from the car. And we feel this is really valuable. And over the 3 or 4 years that this has been running, we've trained over 1,500 now first responders in 63 locations across the country.
Toby, it's been a pleasure chatting with you, and we're running out of time. But it does sound like Careflight is much bigger and more complex than just the kind of image that I had of a helicopter and a doctor in Sydney.
That's right. We've certainly evolved and grown over the time, and we continue to strive to deliver better services to more people through research and development and growth. Dr.
Toby Fogg, it's been a pleasure having you with us today. If people want to get in touch with Careflight, how can they do that?
Thanks very much, Wayne. Yes, by all means, if anyone wants to get hold of us, if you go to careflight.org, you will find our website that details all the activities that we get up to, and it has all our contact details there as well.
If you just missed my conversation with Dr. Toby Fogg, Medical Director of Careflight, then there's good news and more good news. The good news is there's a transcript of this interview on our website at www.hpr.fm. There's also an audio archive of our conversation, both on YouTube and SoundCloud, and there are links to that on our website. Toby, thank you for your time. I realise you're a busy man, and I do appreciate you joining us today.
Thanks very much, Wayne. Thanks for having me.
You're listening to Health Professional Radio. My name is Wayne Buckler.